Depression has been making millions of lives suffer. It is a common mental health disorder associated with weakness and are not yet fully understood by the society, therefore experiencing a huge stigma. Let us not take for granted depression, for it causes 13.6 to 15.6 times higher prevalence of having dementia. Moreover, depression also causes 11.7 to 12.9 times higher risk of having Alzheimer's disease. Let us stop mental health stigma. Let us use our voices and help the mental health community. Seek advice and help from mental health professionals. End stigma now.
Over the past few months, schools and workplaces have migrated online to halt transmission of the coronavirus. Students and workers stare at the screens of their digital devices 24/7. But did you know that overexposure to digital devices can negatively affect eye health? Studies show that digital device use for over 5 hours a day is a significant risk factor for digital eye strain, a condition characterized by symptoms such as dry eyes, itchiness, and headaches, with an odds ratio of 3.6. A distance of fewer than 18 inches from the screen was also found to be a minor contributing factor. With this being said, I would highly encourage students and workers to minimize screen time as much as possible and take breaks in between long working sessions. This way, we can protect our eyes for when we are free to see and explore the wide world once more. Thank you very much for listening and have a great day.
Summer is coming. The sun is shining bright, perfect for beach trips, park strolls, and other outdoor activities. But the intense heat can be a cause for concern for our skin. Acute sunburn or solar erythema may be acquired from prolonged sun exposure. So, we must protect ourselves from this intense heat. Melatonin is one such protective agent. A topical cream consisting of 12.5% melatonin has been found to significantly reduce the effect of solar erythema on those with a more sensitive skin to sun exposure. With that said, remember to always put sun protection whenever going out. Stay safe and have a great summer.
Itchy Chan! Kamusta kayo, Chan? Did you know that there are billions of microorganisms in our gut that help in digestion? And probiotics can help add and maintain healthy bacteria in our digestive system. From this, we can experience the benefits of a reduced risk of diarrhea, improved mental health, a healthy heart, and a boosted immune system. A study in 2016 showed that probiotics can have significant effects in the therapy of ulcerative colitis. Patients supplemented with probiotics have a more enhanced recovery compared to the patients only treated with mesalazine. Addition of probiotics help patients to have better stool frequency, endoscopic findings, physician assessment, and they also have less rectal bleeding. So, come on, mag-probiotics na para everyday okay!
Sleep is very important. We need to sleep to stay healthy and avoid getting sick. It also plays a big role in our mental health, or how we think and how we feel. In a 2019 study, it was found that college students who do not sleep well were 1.39 times more likely to show signs of anxiety than those who sleep well, meaning it was more common for them to worry too much or show other signs of anxiety. These people were also 1.52 times more likely to show signs of depression. Some signs of depression could be feeling super sad, empty, and hopeless. And you become more likely to have these signs as your sleep worsens too. These are signs of poor mental health, and this could get in the way of living normally. So what should we do? We can start with our sleep. So at night, let's do our best to get that 8 hours of sleep, and let's sleep well for better mental health.
With the rising popularity of vitamin supplements, it is important to understand that this should not be your go-to in acquiring them unless necessary. One of the natural sources is sunlight. which converts 7-dehydrocholesterol in our bodies into cholecalciferol, also known as vitamin D3. In a study performed in India, 2 groups of vitamin D deficient individuals underwent 1. Increased sunlight exposure and 2. Cholecalciferol supplementation, respectively. While both of these groups had significantly higher levels of vitamin D at the end of the experiment, those that were exposed to sunlight had improvements in their lipid profile, or in other words, they had lower levels of total cholesterol compared to their counterparts, which had significantly higher total cholesterol. This is why, despite having the technology to produce vitamin supplements, this should not be our first choice. We must first consider natural means that are less expensive and with little to no side effects.
Of esophageal cancer reveals that people smoking more than 14 grams of tobacco per day had approximately 6 times the odds when compared to non-smokers, and consuming more than 53 grams of ethanol daily leads to an approximately 5 times greater odds in developing esophageal cancer in comparison to non-drinkers. When both of these factors are combined, it will lead to 8.5 greater odds in developing the condition. To avoid the risk of acquiring esophageal cancer, you would want to quit smoking and remember to drink responsibly.
Medical treatments for disease include many things such as procedures, surgery, and the prescription of medicine. An important factor in its effectivity is the adherence of patients to treatments. According to a cross-sectional study, predictors of patient adherence are receiving complete information from the healthcare team, as well as having adequate knowledge about their medication regime. The odds of adherence to treatment is 3.89 times more likely for patients who receive complete information compared to those who did not, and 4.17 times more likely for patients who had adequate knowledge about their medication compared to those who did not. It is important that healthcare workers ensure that patients receive complete information so that they may understand the disease and better adhere to their treatments. Let us do our best in educating patients to ensure their healing both in the hospital and at home.
Obstructing proliferations in the number of diabetics worldwide, the failure of the efficient delivery of mainstream therapy in spite of tremendous strides in modern medicine, and the need to revitalize normoglycemia in diagnosed patients without hostile effects call for an intervention that significantly leads to a cure for type 2 diabetes mellitus. Findings show that dietary intake of selenium is positively correlated with the onset of diabetes mellitus. Selenium-rich foods include a variety of foods including wheat, livestock and poultry, fish, rice, and eggs. While further studies are needed to corroborate the claim and to provide the pathophysiological mechanism concerning this, it is highly recommended to carefully consume selenium-rich foods in moderate amounts in our diet so as to prevent the emergence of diabetes. Together, let's beat diabetes!
Drug resistance is a global concern, primarily on diseases caused by pathogenic microbes. Resistance occurs most often through mutations or genetic changes in the survivability of the microorganisms, and these changes result in the diminished effectiveness of a drug. A 2016 study found out that suboptimal adherence or misdose, being a female, and current non-nucleoside reverse transcriptase inhibitor-based ART independently increased the odds of virologic failure. Further research will be done as to aid in the decline of the number of treatment options available due to drug resistance. In the treatment of serious infections such as HIV, the observance of proper protocol for medications such as dosage and frequency is a must.
ADHD is a behavioral disorder characterized by inattention and hyperactivity. This leads to dysfunction in personal, social, academic, and family life. Stress impedes parent caregiving, in turn exacerbating symptoms of ADHD in children. But psychoeducation was able to improve management outcomes by decreasing stress levels of parents immediately and 6 months thereafter. This just underscores the importance of psychoeducation in the treatment and management of ADHD. With the correct understanding and perspectives with ADHD, we are able to prevent long-term manifestation of the condition. ADHD is indeed a serious matter, and the psychological wounds that may be had because of it may scar the child throughout his or her life. That is why we must avoid this occurrence at all costs.
Ladies, have you had your loop electrosurgical excision procedure yet? You've probably noticed some vaginal bleeding. Don't you want that wound to just heal already? Why not try Chitosan tampons? They're far more effective than your regular tampons due to the Chitosan's antibacterial and wound healing nature. After 2 weeks, these tampons will reduce bleeding in 28.6 more women than regular tampons. And after 4 weeks, these will completely heal the cervix of 25.4 more women. Wow! So if you're worried about your loop electrosurgical excision procedure, don't be. We've got you covered. Chitosan tampons, the healing touch you need.
Cervical cancer is the second most common cancer in the Philippines, killing 12 Filipinas every day. Early detection through routine pap smear can contribute to a better prognosis of cervical cancer. However, repeated screening requires laboratories and well-trained and experienced staff, and high costs, which are not available in many developing countries. These problems has led to the development of several cheap techniques, such as the use of magnification and visual inspection with acetic acid, or VIA. VIA has higher sensitivity compared to pap smear in the detection of low and high-grade cervical lesions. As the burden of cervical cancer remains to be high among Filipino women, I, Zaya, am calling for coordinated nationwide action to support the spread and availability of both preventative and curative measures for cervical cancer. Thank you.
Multiple sclerosis is a chronic progressive disease that damages our brain and our spinal cord. It impairs our speech, vision, muscular coordination, and also lead to severe fatigue. But did you know that vitamin D deficiency can be a predictor for multiple sclerosis progression? Vitamin D deficiency is also associated with disabilities. That is why it is extremely important for us to maintain adequate vitamin D levels. But how can we do it? We can eat food that are rich in vitamin D such as fatty fish, liver, mushroom, egg yolk, and fish liver oil. We can also spend a few minutes in the sun before applying sunscreen. This will help us regulate our inflammatory responses and also have a protective measure for our nervous systems. So what are you waiting for? An intake of vitamin D will surely help us be healthy.
Cholinergic urticaria, which we will call CU, is a type of hives that is thought to be induced by a rise in body temperature. However, its exact etiology and pathophysiology are not very well understood, hence treatment options are limited. There are various theories which attempts to explain it. It was found that atopy may be linked with CU. That is indicated by a greater atopic tendencies among CU patients as compared to healthy individuals. It was also found that atopic CU patients as compared to non-atopic CU patients have a greater disease activity, a poor quality of life, and a different seasonal pattern of symptoms, and these differences must be considered in approaching CU. And while there is an apparent link between atopy and CU, we must always remember that correlation is not causation.
Vitamin A deficiency, or VAD, affects about 190 million children worldwide. It causes night blindness, increased susceptibility to infection, sometimes even death. One solution to this is vitamin A fortified cooking oil, which has been shown to increase vitamin A levels in infants, children, and lactating mothers by 12 to 14%. Food fortification is a cost-effective method that applies not only to vitamin A but other nutrients such as iron and zinc. Indeed, many countries, including the Philippines, now require the fortification of certain staples, but food fortification has yet to become a global standard. More legislation is needed to increase mandated food fortification in all countries, expand the nutrient coverage of these laws, and assure the quality of products. With more research on fortification methods and a stronger political will to execute these laws, life is sure to be fortified.
We often hear of students pulling all-nighters or becoming dependent on coffee to stay awake in class. This being said, we can see that getting enough sleep is often neglected by many. However, our body always notices its effects. A reduced amount of sleep was found to increase certain risk factors of type 2 diabetes in early life, which may manifest as the child grows older. In children, an addition of only 1 hour of sleep was found to lower body mass index by 0.19, insulin resistance by 2.9%, and fasting glucose levels by 0.24%. This shows us the importance of developing healthy sleeping habits from a young age and valuing the importance of rest in our everyday lives.
Rest well.
Chronic kidney disease, or CKD, is the gradual loss of kidney function for over a period of 3 months or even 4 years. It is considered a global public health problem, mainly due to the cost of treatment and to the number of patients. Type 2 diabetes, hypertension, increased waist circumference, and family history of CKD are all associated risk factors for the disease. Most of these factors can be alleviated by having a healthy diet, exercising regularly, avoiding drinking and smoking, and by having regular checkups in the clinic. However, not everyone can afford to maintain all of these. That's why I implore that we should also advocate for a better universal healthcare system so no one gets left behind.
Aging is inevitable, and we'd all eventually get there. As we know, because of the natural wear and tear of the human body, a lot of diseases come as we age, one of which is cognitive impairment, in the forms of either memory loss or problems with processing or reasoning. Of the many ventures done to delay these effects, one is actually dancing. This is because dancing entails effort in remembering, practicing, and concentrating on executing moves accordingly. In fact, in a study done by Yi et al., senior patients diagnosed with mild cognitive impairment, or MCI, who underwent dance therapy presented with better memory after 3 months and quicker processing speed after 6 months as compared to those who did not undergo such. So, you want to combat these negative effects of aging? Let's pick up our dancing shoes and dance the night away. Let's dance the night away. Thank you.
Good dog! Westernization of lifestyle patterns in the past decades has led to an increase in the prevalence of diseases such as hypertension, diabetes, obesity, and stroke, to name a few. But how do these lifestyle practices affect the prevalence of eczema? In a study conducted by Adhd et al., it was found that smokers are 2.15 times more likely to develop more severe hand eczema compared to non-smokers. On the other hand, and perhaps more shockingly, normal BMI and lower stress levels did not necessarily lead to less severe hand eczema. In conclusion, this study adds more severe hand eczema to the long list of diseases associated with smoking. It's time to pack away those sticks and lighters for healthier skin. Tagsgalduhag, tigabedu walay megapmig.
Myopia of nearsightedness is a visual disorder in which the affected individual has trouble seeing objects at a distance. It is very common and as claimed by the American Optometric Association, around 40% of Americans are affected, and this number continuously rises, especially in children of school age. Myopia can cause other visual impairments such as glaucoma and cataracts, and the treatment of such disorders can be financially burdensome. So, as with any other disease, prevention would be better than cure. Childhood myopia has a lot of risk factors, but one that is more manageable is sleeping time. A study has found that children who sleep late, specifically at 9:30 p.m. onwards, have an increased risk for developing myopia or having it progress faster. So, a good preventive strategy would be as easy as consistently sleeping early.
Good day. The modernization of society has led to an increase in the daily use of computers across the population, and it is amplified even further by the pandemic. With so much of our lives, especially work and education, relying heavily on these technologies, we expose ourselves to certain musculoskeletal disorders, two of which are non-specific neck pain and lower back pain. It has been found that these two disorders are associated with the computer screen position and the room temperature. Placing the monitor to the side instead of in front is an identified risk factor, and so is a colder room temperature. Along with other precautions such as observation of proper posture, mindfulness of your work setup can literally save you from a pain in the neck. Thank you.
I bet every person on this planet has heard of this line. Breakfast is the most important meal of the day. You might be wondering, how true is this? Breakfast, as its name implies, breaks the fast during our overnight sleep. Many studies have shown the benefits of eating breakfast, but probably one of the most appealing is that it jumpstarts our metabolism and helps us burn more calories. A study done to Malaysian adolescents showed that people who skip breakfast tend to have a higher body mass index, higher body weight, higher waist circumference, and higher total body fat, thus overall increasing their risk for obesity. And this makes sense. If we start our days with a healthy meal in the morning, we are less likely to make bad food choices later in the day. So, let's always make sure to break our overnight fast and look and feel good and healthy for the rest of our lives. Thank you!
Down syndrome remains to be the most prevalent chromosomal disorder, affecting 6,000 babies a year, which equates to one baby affected by Down syndrome in every 700 babies born. This illness has caused individuals significant delays in development and produced intellectual disabilities that last a lifetime. There is no cure for Down syndrome, but with the entry of the digital age, new interventions are surfacing to combat its effects and improve the individual's quality of life. Virtual reality technology in particular has proved to produce substantial improvements on their posture and motor development. This emphasizes the necessity of building towards research and development to help the people within the spectrum and using technology to provide avenues for their health and welfare. Let us utilize these technologies to uplift our fellow men with Down syndrome.
We are no strangers to watching what we eat, but keeping our nutrient intake unbalanced may just cost us our lives. The results from a study has shown the association of a high dietary sodium-potassium ratio as a long-term risk factor for cardiovascular disease, all strokes with emphasis on hemorrhagic stroke and total mortality. In other words, not only a higher sodium intake but a lower potassium intake significantly increases your chances of having a stroke. To avoid this, refrain from eating sodium-rich foods such as junk foods, canned goods, and instant meals, and opt for healthier potassium-rich foods such as bananas, oranges, and avocados. Keep in mind that cravings are temporary, but health is for life. Itadakimasu!
In today's time, mental health has been given more attention and importance. And with mental health disorders, such as depression, still prevailing, exercise can serve as an alternative treatment in lessening the effects of such disorders. It was found that exercise, regardless of intensity, whether it be light, moderate, or vigorous, can be as equally effective in treating mild to moderate depression compared to the usual treatment by a physician. And that being said, we must be physically active in taking care of our mental health.
But where do you get your protein? People usually ask me that the very moment they find out I'm vegetarian. What they don't know is that it's possible to get our daily serving of protein from plant sources alone. Plant protein consumption is even recommended to overweight individuals as a healthy way to lose excess fat. In fact, it was found that for every gram of plant protein consumed instead of animal protein, obese people can lose 46 grams of fat mass. Isn't that amazing? Just by making that switch alone, we can already shed off some pounds, even if we're technically eating the same amount of food. This proves that being plant-based isn't only good for animals and the environment, but also for our health. Join me and together, let's be healthier. One veggie at a time.
Galaw-galaw naman dyan, uso sakit sa puso. Ever heard that phrase? Well, they have a point. Did you know that more than 1/5 of adults and more than 4/5 of adolescents fail to meet the WHO standards for physical activity for health? Now, just how is this important? Results from a study in Spain show that different heart diseases and other factors related to it are associated with sedentariness or low physical activity. These include: this means that low physical activity raises the risk for acquiring these complications. Now, don't lose hope. We can still combat this. Even just 30 minutes of moderate physical activity a day can help to steer clear of medical complications in the future and generally for a better you. Join the movement for movement.
Even as children, we have learned that vitamins do great wonders for our body, keeping us healthy and nourished. But even as adults, the intake of adequate amounts of vitamins, in this case vitamin E, is still very important. Current evidence suggests that the intake of adequate amounts of vitamin E improves metabolism, highlighting lower levels of blood glucose and fat. Furthermore, the intake of the recommended amounts of vitamin E daily shows a decrease in prevalence of non-alcoholic fatty liver disease, one of the prevalent growing liver conditions globally, and reduces the risk of developing its much severe forms by 52 to 55%. As such, include nuts and green leafy vegetables, some of the well-known vitamin E-rich food in your diet. However, over-reliance on vitamin E or any other vitamins is inadvisable. Having the right lifestyle and diet, as well as consulting your physician and nutritionist first before supplementation, is still very important.
Patients with ADHD experience a lot of difficulty in school, work, and making friends all throughout their lives. We know about the condition, but we don't actually have a lot of well-researched ways for assessing ADHD in adults. So what about those who couldn't get diagnosed early? Thankfully, one research has shown that the test we call the SDQ was effective for determining ADHD not just in children but in adults as well. Under the ROC curve analysis, the test was shown to have an AUC at 0.90, indicating high validity. So we might be able to use SDQ for monitoring ADHD progression. Psychiatry lags far behind other fields in medicine, especially in research. But mental health isn't less important than physical health. Like people with ADHD must live through difficulties all throughout their lifetime. We know so little about mental health, but it doesn't have to stay that way. For those who are interested, I encourage you to try pursuing psychiatric research in the future. Who knows what kind of change and healing simple discoveries like this can bring about.
We all know that water is essential for our survival, and we know that insufficient intake of it have negative effects on our health. This is common sense, but most of us forget to drink sufficient amount of water a day. It was proven that dehydration negatively affects our mood in terms of the following. It was also proven that it negatively affects our thinking in terms of short-term memory and attention. In contrast, when we rehydrate, it will lessen our fatigue and total mood disturbances. And it will also improve our short-term memory, attention and reaction time. So when you feel fatigue or that you can no longer pay attention, maybe it's time that you drink your water. We are preoccupied by a lot of things such as the pandemic or the new normal setup. But this is a reminder for us to always keep in mind our water intake before it takes a toll in our minds.
Amid rapid urbanization, government policies and urban planners must be more considerate and efficient in utilizing every space available. One that they should always keep in mind is having enough green spaces, which can include public parks and plazas. Besides this well-known benefit of preventing airborne disease and pollution, did you know that it can also prevent psychiatric disorders? A study of more than 900,000 people found out that children who grew up with the least green spaces available to them had up to 55% higher risk of developing a psychiatric disorder in comparison to those with the most green spaces available. Even adjusting for other factors such as socioeconomic status and family history, the estimated risk reduced only slightly. Join me as we call for better and more green spaces in our urban centers to help reduce psychiatric disorders and improve overall mental health.
Polycystic ovarian syndrome or PCOS is a hormonal disorder that affects 1 in 10 women of reproductive age. Women diagnosed with PCOS produce higher than normal amounts of male hormones, leading to physical symptoms such as the following. A woman suffering from PCOS may also experience elevated stress, leading to depression and anxiety. And vitamin D deficiency is also said to be associated with mental health problems. In a study conducted in 2019, results show that women who took combined vitamin D and probiotic supplements have significantly lower scores in mental health disturbance parameters compared to those patients who did not take the combined supplements. There is a need to explore more about these supplements through research, as it is essential to reduce physical symptoms. Improving the mental health of PCOS patients is equally important because mental health is an integral component in one's holistic well-being. We have to make healthy choices not only for our bodies, but also for our minds.
What if I tell you that your years of education can actually predict your health? According to one study, the prevalence of diabetes, aside from being associated with smoking, is also associated to some demographic and socioeconomic factors, and that includes your level of education. More specifically, it was found that unlike those with college education, the prevalence of diabetes is 1.41 times higher among those with elementary education, 1.33 times higher among those with middle school education, and 1.30 times higher among those with only high school education. With that, join me as I call for a nationwide effort to promote better health outcomes through a better and more accessible education, and thus helping more people to have well-informed choices about their health. Just remember, degrees keep you from disease.